Good morning. My name is Asha Thomas. My ANP topic for clinical teaching is triage. So starting on with the introduction. Triage is an emergency department. The word triage is derived from French word trier, meaning to choose or to sort. Patients are classified according to the type and urgency of their conditions to get the right patient to the right place and right time with the right care provider. Definition: triage can be defined as a process of prioritizing patient treatment during mass casualty events. Or triage is the process by which patients are classified according to the type of agency and urgency of their conditions to get the right patient to the right place at the right time with the right care provider. Aims or goals or objectives of triage: to identify the patient with life-threatening conditions, to determine the most appropriate treatment area for patients presenting to the emergency department, to decrease congestion in emergency department areas, to provide ongoing assessment of patient, to provide information to patient and family regarding services, expected care and waiting times, to contribute information that helps to define departmental accuracy, identify the priority of the patient needed for medical treatment and transport from one emergency scene, track the patient progress through the triage process, identify additional hazards such as contamination, to ensure the patient are treated in the order of the clinical urgency, to ensure the treatment is appropriately and timely, to allocate the patient to the most appropriate assessment and treatment area, to avoid congestion, to provide ongoing assessment of the patients, to provide information of the patient and families regarding services, expected care and waiting times, to contribute information that helps to define departmental acuity, do the greatest good for the greatest number of patients. Now coming on with the types of triage. First is the primary or field triage. Only transportation, start and save disaster scenario. Second is the secondary emergency department triage. This is timely and appropriate intervention, color coding. Third is the tertiary triage. Specialized care is provided here, or it can be divided into the following types. Simple triage. It usually is used in a scene of an accident or mass casualty incident in order to sort patient into those who need critical attention and immediate transport to hospital and those who are with less serious injuries. The second type is advanced triage. In this, doctor and specially trained nurses may decide that some seriously injured people should not receive advanced care because they are unlikely to survive, in order to increase the chances of others for higher likelihood. Now the other one is the continuous integrated triage. It is an approach to triage mass casualty. It combines three forms of triage with progressive specificity, most rapidly identifying those patients in greatest need of care while balancing the need of the individual patient against the available resources. Continuous integrated triage employs group triage, individual triage, hospital triage, reverse triage. Now coming on with the reverse triage. This process can be applied to discharging patient early when the medical system is stressed, during a surge in demand touches immediate after a natural disaster. Many hospital beds will be occupied by regular non-critical patients. In order to accommodate a greater number of new critical patients, the existing patient may be triaged and those who will not need immediate care can be discharged. Under triage. It is the underestimating the severity of an illness or injury. An example of this would be categorized as priority 1 immediate, priority 2 delayed, priority 3 minimal. Now the other type of triage is over triage. It is the overestimating of the severity of the illness or injury. An example of this would be categorizing as priority 1 minimal, priority 2 delayed, priority 3 minimal. Across the room assessment. First is the airway. Abnormal airway sounds, stridor, wheezing, grunting, unusual procedure, example sniffing position, inability to speak, drooling or inability to handle secretions. Second is the breathing. Altered skin means skin cyanosis, bradypnea, apnea periods, nasal flaring, audible wheezes. Third is the circulation. Altered skin signs, pale flushing, uncontrolled bleeding, disability due to neurological problems, decreased control, loss of control, decreased interaction with environment, inability to recognize family members, unusual irritability, response to pain or stimulus, decreased flaccid or hyperactive muscle tone. Patient categories. First, non-disaster emergency management department triage to provide the best care for each individual patient. Second is disaster. Third is to provide the most efficient care for the greatest number of patients. Non-disaster or emergency department triage identify patient requiring immediate care, determining the appropriate area for treatment, facilitate patient flow through the emergency department and avoid unnecessary congestion, provide continuous assessment and reassessment of arriving and waiting patients, provide information and reference to patient and families, allay patient and family and society, and enhance public relations. Now coming on with the types of emergency department triage system. Type 1 is traffic director, non-nurse. Type 2 is spot check. Type 3 is comprehensive. Two-tiered system. Initially screening by registered nurse who greets each patient on arrival, perform a primary survey and determine whether the patient is able to wait for further assessment by the second tried nurse. Divide tasks among staff nurses. Disaster triage, start and then save. Start triage done in the field by the rescue personnel. Simple triage and rapid treatment start technique. A quick assessment of respiration, perfusion, mental status. Equipment requirements. Emergency equipment facilitate the use standard precautions like hand washing, facilitate and gloves. Triage team. Emergency physician. The physician performing hospital triage should be acknowledged as being in command of the triage area, should be clearly identified by the specially colored vest or other garment, and must understand all triage options. If identification of patient is not available ethnically, gender and appropriate age should be noted on the tab. The information is entered into the department log and is also placed into the triage logbook. Security personnel, media center, official person involvement is equally important to successfully triage all the patients. Adequate communication devices like telephone, intercom facilitate for recording triage information. The vital signs: airway, chest, abdomen, pelvis, mental status, all is required. Triage levels. First is the resuscitation, second is the emergency, third is the urgent, fourth is the less urgent, yes, that is yellow, fifth is the non-urgent, that is green. Save triage guidelines. Crush injury to the lower extremities, head injury, bone injury, abdominal injury. The key points to be remembered: the triage area must be immediately accessible and clearly signposted. Its design should be for patient examination. Means of communication between entrance and assessment area. Privacy. Strategies to protect staff will exist. Now the triage category. First is the red color. First priority, most urgent, life-threatening shock for hypoxia is present. Second is the yellow, that is the second priority, that is urgent. The injuries have systemic implication on effects, but patients are not yet in life-threatening or hypoxia. Third is the green, third priority, that is non-urgent. Injuries are localized without immediate systemic implications. Black is dead, no distinct care be made between clinical and biological death in a massive casualty incidents. Now, characteristics of emergency medical treatment in triage. Extensive knowledge to emergency medical triage, adequate training and competent skills, ability to use the critical training process, good thinking maker. Documentation. Documentation includes date and time of assessment, name of doctor, triage nurse, chief presenting problems, relevant history, relevant assessment finding, initial triage category allocated, any diagnosis, first aid treatment measures initiated, nurse's name, chief complaints and presenting concern, triage level, allergy, medications, first aid measures, retriage. His or her condition changes while they are waiting for treatment. Additional relevant information becomes available that impacts the patient's urgency. Both the initial triage and the subsequent categorization should be recorded and the reason for the retriage documented. Now, tertiary triage. It is done after initial resuscitation and stabilization following emergency department triage by the specialist to assess and allocate which patient required emergency surgery, requires admission into intensive care unit or special ward, can be discharged from the site. Take home messages. Each and every emergency department should have their well-organized triage plan to tackle mass casualty disaster scenario in the hospital. Pre-designed triage team along the training of all staff like doctor, nurses and other healthcare providers to be pursued in every hospital. Now coming on with the role of triage nurse. Greet patient and identify yourself. Maintain privacy and confidentiality. Visualize all incoming patient even while interviewing others. Maintain good communication between triage and treatment area. Use all resources to maintain high standard of care. Teaching use a thermometer first aid. Control the crowd if any. Telephone. Communicate with team leader and seek feedback on decisions. The nurse should have rapid access or be in view of the registration and waiting area at all times. So here finishes my topic. Thank you.